Excellencies, ladies and gentlemen, I'm honored to join you at the Global Dialogue on Social Protection and People Living with HIV and Key Populations Most at Risk of HIV. Here in Pakistan, following the vision of Prime Minister Imran Khan to develop a welfare state, I've been driving forward the development of Ehsaas, which in Urdu means compassion. Ehsaas is the biggest anti-poverty project ever launched in our country. My experience as Special Assistant to the Prime Minister of Pakistan on poverty alleviation and social protection, and as someone spearheading Ehsaas, is one I'm keen to share with others around the world today. From the outset, Ehsaas was designed to bring social protection schemes under one roof and ensure the poorest and most marginalized communities have access to all the schemes. This also includes people living with HIV who often face stigma, which undermines their ability to access key benefits and government schemes. According to UNAIDS, there are approximately 190,000 people living with HIV in Pakistan. For Ehsaas, it's important to engage the HIV community and other at-risk communities to hear about the challenges they face. I spent a lot of my personal time talking to beneficiaries from around the country to understand the challenges they face, and working to systematically remove the barriers that prevent marginalized communities from accessing the services they need. For marginalized groups living in Pakistan, including people with HIV and those at risk of the disease, we have focused on developing a one-stop shop, both physically and digitally, to minimize bureaucracy, to save money and ensure the right people are accessing the right schemes when they need them. Under our health insurance program, the Sehat Insaf card has been created and distributed to marginalized groups, including the transgender community, so that they receive free of cost health coverage, including for HIV, AIDS, and all types of cancers. Last March, as the government was forced to lock down the country to stop the spread of coronavirus, we needed to mitigate the socioeconomic damage of the pandemic alongside the health risks. So within 3 weeks, my department led a cross-government effort to create the Ehsaas Emergency Cash Program, the largest social protection program in the country's history. Rolled out just 10 days after the lockdown began, it delivered one-time cash grants totaling more than 1.2 billion to more than 15 million households, covering nearly 100 million people, which is over 40% of the country's population. By combining phones, internet connectivity, data analytics, and national IDs, this was a demand-based social protection system that is replicable for other emergencies. As we look to end the acute stage of the pandemic and recover together, we must ensure that people living with HIV and all marginalized communities have both the social protection and means to grow. Developing and contributing to these communities and the country overall is what drives our work. I thank you.